what the SOA of the healthcare looks like. So on our transferred patients, we'll start off with the transferred patients, which is basically from um, the leads submitted that we have, consolidated leads that we have. This will be the source. So this source is from Brandon's sheet, Brandon's form, which I don't have any edit access. So what I did is I imported all the information, and then we somehow got a summary of it and collected them all here on this doc. So this doc will then be is then copied manually over to this SOA. So the first sheet will be the SOA for the transferred, wherein we input all of the uh, clients or the patients which has adjudications, or these are patients that we transferred over to the triage. So say for example, in one case where Lily Andrews has two products which were shipped, we highlight them in green, and their amounts will be on their specific month when they receive their product. So, for example, for the next example, let's say for topical cream, which is pain, their adjudication will be 1505. So that is good for 3 months, and they receive it. Well, supposedly this is their 122. So this amount should be on January to March. There we go. So, and this will be the total for these three. So this is basically the SOA. The part of it will be the center name, the patient name, the phone number, the broker name, creation date, the transfer date. We have their state, their time zone, their best time to call, their coverage, the insurance number, and the VIN number. And then these are the products that we cover under healthcare. Next are the list of the transferred patients. So these patients is on our list, which basically we transferred on our record. We transferred them over to the triage. So this is what we monitor most of the time. So in this doc, it indicates the patient's information as well, their state, and for the triage, um, based on their notes, where we get from their portal, they were able to complete the verification and the verification process with all the medicines and their medications. Now, if on the notes it says that they were warm transferred to a doctor, I indicate yes. Now, if it is a no, it's either they scheduled an appointment or they were not transferred over because they hung up or whatnot. So in this case for Tracy Roche, she was never triaged. Based on the notes, she was never scheduled to be transferred to a doctor, or she was never scheduled to come to a consultation and was never transferred to a doctor. So these are the simple indications that based on their notes, on the triage notes. So on the statuses, this is also from a portal, telemedicine portal, where they put the statuses of each patient, whether their brace are, or what the status of their products are. For example, the back needs attention because on the status it says request or assistant requested. It's either they need the date of birth or whatever it is on the notes. Now, when it is filled, we usually color it red. And next, on this column, we have the categories lost, patient rejected, shipped, failed, why not, needs attention, and never transferred but submitted. So the lost ones are in gray, meaning that we transfer them over, but there were no statuses on their portal. So we are indicating them just to ensure that we are not overpaying, or say we are not reporting it over to them, because they will think that these are actual transfers with statuses, but in reality, these were not reported. So the next one will be the never transferred but got submitted. So say in I have indicated them in blue. So this one, because uh, we only transferred ankle and wellness, but it turned out in the report it says they also they shipped the back. So we have to report this, or we have to put that on our report, so that we all of the figures will be 100%. So I'll explain that in a bit. So these are the indicated the number of products with their specific notes depending on the statuses. So we have the ship, failed, contacting patient, um, there, missing products. So the percentages above. So the first numbers in row 3 are the total products that we have there below for the patients. Now these percentages are divided over the number of total products that we actually transferred based on the report that we have. So in this case, it's 169. So we divided 22 by 69. That's 13. And then, and so on. Now for the other cases, so this should also be totaled to 169. So the same formula, this total divided by the number of products that we transferred, which is 169, which gives us a 49%, meaning this 49% out of the 169 or the 83 products were lost or they're missing from the report. So we have to have this on, we have to have this so that we can ask them for the explanation why they did not report this. And let's see, next. And these are the number of products that we have reported. So for braces, wellness, and creams, so it's the same formula. These products number, total number of products divided by the number of total transferred. And this is also a percentage of how many were actually written, we had their scripts written or the prescriptions written based on their report. So this is 49%, and these numbers are these are we count the number of not submitted here, the authorized and the not authorized, as well as the Medicare BD, B, or private. These are all here. I just inserted a note just to make sure what those numbers are. And then I also have a report for the missing patients. Well, the missing patients, these are the ones that didn't have the report statuses on their CRM or on the REN. So what I did is I transferred them over here, and then I put in on details all of the notes and all of the dates when they when they contacted the patient. So I also made a tally or a total of the total callbacks that they have made or they have done. See to make sure or to see whether they have done enough to so that this patient is what they are on their status. So like for this one, they're unable to contact, but they only called the patient once. They were able to follow it up ever since February 1st. So there you go. These are their notes, specific notes for specific dates. And where we get this data, as I've mentioned, is on the consolidated leads, which we have on our system as well. So on the consolidated leads, we have the three forms from Randon, which I don't have access to. What I did is I just copied everything on that form. I imported it through a formula and then transferred it over to this doc. And then we had um, and then this one will be the daily report or the weekly report that we have. So we would know how much or how many patients were transferred over